Hello, I'm Dr. Inman. This is this mini lecture on canine epilepsy or canine idiopathic epileptiform seizures. Seizure activity in animals scares the hell out of most clients essentially. We don't see it very commonly, if at all, in the feline or the equine so much, but we see it common in the canine because the threshold that they have to actually exceed to fire off a series of idiopathic stimuli up and down the spinal cord is actually much lower. Actually, it's even lower than the human being, and so dogs more commonly have what's called idiopathic canine epilepsy. It's called idiopathic because no one seems to know where it comes from, essentially. Anytime you hear the term idiopathic, you should probably think that old Dr. Bill suggested most idiopathic disease conditions are caused by a disease process that isn't even recognized in veterinary medicine, which is the vertebral subluxation complex, a neuronal interference that occurs at the spinal level, which we treat with a spinal adjuster, essentially. When an animal has a seizure, it almost acts like when you get a pinball up in the upper reaches of a pinball machine and it slams around up in there and seems to basically have a life of its own. Well, that's what happens when we have a neurological pulse that comes across the outside of this nerve system in these animals' cases, in these animals' bodies. It goes all over the central nervous system, which is the brain, the spinal cord, down to about L4-5. So anything along the spinal cord like that can fire off a foci of electrical discharge, and if it exceeds this level, it self-propagates through the animal's body, and a seizure can last anywhere from a couple of minutes to 15 or 20 minutes. Longer than 20 minutes, the animal usually doesn't make it. It almost always exhausts itself before that. And so a seizure isn't a damaging type of situation. It occurs, and most dogs will have a seizure in their lifetime. One of the ways that veterinarians have always treated seizure activity is to intoxicate the neurolemma, or intoxicate the actual nerve system that propagates these electrical impulses by using a barbitrate, a phenobarbital essentially, or actually unbalancing or rebalancing the acid-base balance across the cell membrane with potassium bromide. When veterinarians are approached by animals that are on medication, essentially, that still seizure, they increase the medication. At a certain point, they don't respond to medication. Those animals have to be put down. What we found when we were presenting this back in 35 years ago is that we were presented with these animals that came to us seizuring, and they were owned by chiropractors wanting us to adjust the animal, and we just told them that, I said, well, your dog is suffering from a deficiency syndrome of phenobarbital and potassium bromide. You need to increase the dose. They said, no, doc, we want you to adjust these animals. And we would adjust them and found out that almost every one of them had a reading pattern on the left atlanto-occipital area, which is really not common. The most common subluxation that we see in the canine is the right atlanto-occipital area over here. But we saw them have a problem on the left side, which of course doesn't belong there, so we would go ahead then and adjust them, and we would continue to adjust them, and as the clients would come back, they would explain to us that they had discontinued the medication, the animal hadn't seizured. We probably saw 50 of those before we finally said, I wonder if this has anything to do with it. Well, of course it does. So now what we do with idiopathic epilepsy is we routinely adjust them with this device. We go through the same pattern, the same technique, the same methodology that we show you for free on the vomtech.com website. Vomtech.com website, you can go there, we'll show you exactly how to do it, why it works, and how to apply it to your practice. So I'm giving you this technology for free. The nature of the certification course is there's about 2,700 disease conditions we've mapped out with a combination of laser or a combination of VOM plus laser or what have you to try to handle these conditions that are pesky problems that veterinarians don't treat very well. We're able to treat them only because we recognize these animals have this neurological interference that artificially elevates that level close to being right underneath that threshold to fire off a reflex of a series of events that occur in the spinal cord called idiopathic canine epilepsy. It's not idiopathic, it's caused by vertebral subluxation complex. Interesting, in the last 5 years we've found that there are MRI, there seems to be in most of these animals on the left side of their atlanto-occipital area a wrinkle in the meningeal sac on the left side. And you're asking me, why is that? And I have no idea, but we found that to be the situation. Basically, it's always evidenced by a reading pattern that occurs at the left atlanto-occipital area. So the whole spinal cord can be really hot. When we go through and adjust them just with this device, 70% of these animals that are on medications, we can take off medication. We show you in the course actually how we go about titrating them off of medication without them having a problem, essentially. It's not difficult. That's good. That was what we did for almost a decade and a half, and then all of a sudden we started to say, well, if that's the situation, we should be able to reestablish normal functionality by reintegrating the neurological tissue, very much like we do in degenerative myelopathy. So we will actually laser the brainstem right here, which is where a majority of this problem comes from, and then we laser the rest of the body like this, the spinal cord. Remember, the central nervous system goes all the way down to L4 and L5, and so this is a central nervous system phenomenon that causes this so-called idiopathic epileptiform seizure. So this frequency is 9, 33, 151, and 60, which are basically frequencies for the midbrain, peripheral nerve, and the spinal cord. We basically go ahead and add that therapy to this animal's therapy. For VOM, we VOM them on schedule, day 1, day 3, day 7, 14, 21, and 28, and then we laser them twice a day for 3 days, once a day for 3 days, and twice a week for 2 weeks. Inside of 3 weeks, we're essentially done with this case, and we have them off of medication, and they don't have seizures again. Now, some animals may have to have this lasering or this adjustment regularly, maybe every 6 months, to keep them from seizuring. Sometimes they'll seizure through this therapy. We adjust them once or twice, and they go 2 or 3 years without throwing another seizure. Most of these animals never have a seizure again. Their problem is because of electrical discharge from an owie spot or a condition or a foci of injury in their spinal cord. And we've found that to be the situation, and what we do is we endeavor to fix that with this particular therapy. So I'd recommend that you go to the website, bombtech.com, and I'll show you exactly how to go about doing that. Thank you for your patience, and have a great day.